Good evening. My name is Dr. Bizzoni. Welcome to Healthy Frontiers. This show is dedicated to the education of our viewers. Tonight's topic is nutrition and the phoenix. And my special guest is Dr. Rob Zembroski. Dr. Zembroski practices in Darien, Connecticut. He's been there for over 13 years. And he's a specialist in nutrition as well as chiropractic. So I'd like to welcome Dr. Zembroski to the show.
Thank you for having me on. Thank you.
Good. You know, you're a chiropractor, but you have a specialty in neurology, I understand. And,
yes.
You also have a specialty, and you're doing a lot of work with nutrition. Talk to me about this machine called the Phoenix and how it applies to your practice. After you tell me a little bit about your background.
Yes. I'm a chiropractic neurologist. Basically, I consider myself a neurologist utilizing chiropractic procedures to improve the nervous system, just as chiropractic's been doing for over 110 years. Right. The Phoenix Physical is, or what we call the Phoenix Physical, is an objective test and a physical test to understand the nutritional needs of humans, if you will. So in our practice, we utilize this type of tests for everyone, from the athlete to the weekend warrior to people that are pretty disabled to the elderly to kids with ADD.
Right. Okay. And what exactly is the testing? Tell me what it tests for.
The test, it utilizes something, it utilizes basically urine and saliva.
Okay.
And so we can understand nutritional needs, how we digest food, the buildup and breakdown of lactic acid for the athlete, how we assimilate nutrients through urine and saliva.
Okay.
And so with a specialized tool or with specialized equipment, we actually utilize a fasting urine and saliva to understand different parameters of someone's health.
Okay.
And those parameters would include pH, which is acid and alkaline type of balances.
Right.
We also look at oxidative stress, and we all know what free radicals do. We know that they help us produce energy, or they can become destructive and give us a biological age that's older than we are. That's premature aging.
Yeah. We
We can also look at something called resistivity. And resistivity is the amount of minerals in the blood, urine, and saliva. So we also have an ability to see if an athlete or an individual is demineralized or over-mineralized. So it's an objective tool that uses urine and saliva to detect those deficiencies.
Right, that's the basis of it.
Yes.
Okay, and you told me that athletes can benefit tremendously, both professional weekend warriors. So tell me, how do they benefit?
Well, top world-class athletes like Evander Holyfield, Yao Ming, these individuals use this technology pre- and post-performance or event to understand what their biochemical or nutritional needs are.
Right.
And so an athlete may say, I want to know what my chemistry is like, how I'm digesting food, what's my physical capabilities previous to my event.
Right.
And so we utilize, again, urine and saliva to run through this machine to understand what kind of losses they're at, what kind of lactic acid buildups they have, if there's oxygen deprivation, how they're digesting their food for nutrient acquisition. All those pertain to essentially anyone, more specifically the athlete.
Now, is that done right before an event, or could it be a couple of weeks ahead, so you have more of a baseline, and then make a recommendation closer to?
Absolutely. So depending on what you're looking to achieve, if it's long-term goals, we do it monthly, we do it by every quarter, or we do it 3 days, 4 days right before an event.
Right.
And so previous to the event, we have an ability to see how you're utilizing your food for energy.
Okay.
And so we can do it right before the event, we do it right after the event to give you an idea of your recovery time, to see what kind of acids have been built up based on your activity and performance levels.
Right.
When we exercise, we use oxygen, obviously, for skeletal muscle and performance.
Right.
The oxygen is also utilized to make free radicals. So we can also tell what your oxygen levels are like, or your oxidative stress is like, based on post-performance.
Okay, that's great. And what kind of results do athletes get from this testing?
We get phenomenal changes, phenomenal results. And doctors around the country that utilize this technology have reported a 30% improvement in their athletes and their performance.
That's great. And that's in their blood health? Talk to me about that, why the Phoenix is so ideal for athletes and their blood health.
Well, the Phoenix Physical, or the qualitative fluid analysis, there's 4 major things that we see super important to the athlete or any individual based on a health concern or just the athlete.
Right.
One, we look at something called blood rheology. Blood rheology is the way that the blood transports nutrients.
Okay.
So we have an idea based on specific values of this testing how the blood is utilizing or carrying nutrients to the endocrine system, the glands, the organs, the muscles, brain activity. That's all based on performance.
Right.
And so based on certain values of this, we know that when an athlete uses oxygen, lactic acid is built up with carbon dioxide, and oxygen is necessary for the elimination of that. And if we don't utilize or get rid of lactic acid, that's when poor performance, injuries take place, fatigue, and energy levels. So in one regards, we can tell the health of the blood of an individual or the athlete based on oxygen levels and how they're utilizing nutrients through blood.
Right.
It's like blood trafficking.
Okay.
So that's one of the things that are imperative to the athlete or an individual.
Great. Okay.
So we also, go ahead.
No, I was just going to say, with digestion, and you just mentioned digestion, how does that work with someone who's having problems with digestion or so?
The digestive process is pretty intricate.
Yeah.
And again, as we're talking about athletes or we'll just say humans in general,
right.
we know that everything is based on digestion.
Okay.
Most of our neurotransmitters, or the nerve chemicals that make the brain and nervous system work,
right.
Develop in the gut.
Yep.
We know that nutrients, fats, lipids, carbohydrates, proteins, amino acids, they're all broken down and assimilated in the gut. So the second real important things for athletes that we look at is something called nutrient acquisition. And so when we look at digestion with this testing, we look at something called pH. And pH, when we look at pH of the mouth, if somebody's pH of the mouth...
Explain to the audience what pH is, because that's a common term that we hear a lot.
Yes. pH is acid and alkaline balances in our body.
Okay.
So we know if somebody has an acidity to them because of exercising or too much proteins or acids in the body, that can lead to fatigue and energy problems and so forth. So when we look at pH per se, it's acid and alkaline balances. We measure those acid and alkaline balances through saliva and urine and blood.
Gotcha.
So everything is pH dependent. Skeletal muscle firing and control is pH dependent. Neurotransmitters or nerve chemicals like dopamine and serotonin are pH dependent. Something real important that nobody really looks at, which all healthcare providers should be looking at, is something called pH of saliva. So we need to look at the pH in the saliva because that's where digestion takes place.
Right.
You know, you hear this, athletes think that they have to carbo load right before they do something, whether it's track and field, a heavy weightlifting event. That's kind of not true because when we look at the saliva pH of the mouth, if the pH is above 6.75, which makes it alkaline, the first place of digesting carbohydrates are in the mouth. So if ptyalin, amylase, these digestive enzymes that start digestion in the mouth aren't released because it's very alkaline, anything we put into our gut won't be assimilated and broken down.
I see.
So we eat something that those enzymes trigger a function of the brain to release acid into the stomach. So if acid is not released into the stomach appropriate, that's where we digest fats and proteins mainly. Carbohydrates, the digestion starts in the mouth. So when we look at digestion for the athlete, it's imperative to understand if their saliva is pH or alkaline or not.
And that machine, the Phoenix, is going to tell you that.
The Phoenix Physical or the qualitative fluid analyzer tells us specifically what the numerical values of the pH of the mouth are.
Okay. And talk a little bit more about pain control. You know, say an athlete or a non-athlete are in pain, how does it play into that arena?
So when we look at pain management and inflammation, we know that athletes, weekend warriors or professionals, develop microtraumas. And the microtraumas are due to obviously their physical activities, sports injuries, just overall endurance type of activities. With those activities, there may be micro tears in the tissues, tendons, ligaments, muscles themselves. With that, we have pain-mediating chemicals like prostaglandins, cytokines, these kind of things. These pain and inflammation chemicals can be reduced based on enzyme therapy and appropriate nutrition. So we can test a person's ability to improve pain management and inflammation based on their pH and oxidative stress.
Great.
So it's pretty nice to see an athlete, whether they have a black eye from boxing or a sprained ligament after some kind of triathlete or sprinting, improve
dramatically,
exponentially in a short period of time.
And I mean, without taking a lot of medication, right? I mean,
without medication.
You're doing this all naturally.
All natural.
All right. Talk about chiropractic a little. How does that work with that?
Chiropractic per se as a physical modality is the best modality really in the world for any human to improve their physical form, neurological function, and to decrease pain and inflammation. We know as chiropractors and chiropractic physicians that when we use manipulation of a joint or a muscle or soft tissue, they will actually inhibit or shut down pain. So chiropractic per se for any athlete's imperative, because not only does it improve musculoskeletal, the muscle and skeletal system and the mechanics of the way we work, but we can improve the biomechanics, which will prevent injuries. We can also decrease pain and inflammation because that's what manipulation will do.
Right, and in conjunction with the nutritional approach, I mean, it's so powerful.
Absolutely.
You know, there's always time that you may need a medication. We know that.
Correct.
Right? But, I mean, most times, it always has made sense to me as a chiropractor. You know, let's try the natural approach first. If it doesn't work, then we always have these other options.
Well, the funny thing is people will say chiropractic manipulation or chiropractic neurology may be an alternative. I'm like, alternative to what?
Yeah.
We either fix you with our modalities in nutrition, and if that doesn't work, which it usually always does, then you can go to an alternative like medication, COX-2 inhibitors, painkillers.
Right. Sure. And you'll get patients, I'm sure, to come into your office as I do, and they talk about chronic fatigue or fatigue syndromes. How does the Phoenix help us determine some of those factors, how to diagnose that properly and treat it?
The Phoenix Physical gives us those 3 parameters of health.
Right.
When we look at chronic fatigue or people that have poor energy, we look at a multitude of different factors. One, if there's free radicals that the body doesn't utilize for energy, what happens is when we use oxygen as an athlete or an individual and just normal metabolic functions in our body, we produce free radicals.
Right.
The free radicals, even when we digest food, free radicals come off the food particles as we digest that food.
Right.
So free radicals are normally there. The thing is, it's not a problem if we produce a free radical. It's what are our antioxidation systems like that will determine if we will biologically age quick or we'll have injuries that don't improve and so forth.
Right.
When we look at chronic fatigue, we understand that chronic fatigue may be a mineral deficient. It may be an adrenal gland dysfunction because of lack of cortisol, which is blood sugar for the brain.
Right.
It could be increased oxidative stress and free radicals.
Sure.
So when we look at energy and chronic fatigue in an individual or athletic performance, we really can pinpoint what the causative factors are based on this type of testing. So we look at also something called resistivity. And resistivity is the amount of minerals in the fluids that we test. Right. Whether it's blood, saliva, or urine. And with resistivity, if an individual is mineral deficient, let's just take an athlete.
Right.
Most athletes beat themselves up without replenishing their bodies and replenishing it appropriately, or their bodies appropriately. With certain values in this fluid analysis, if you will, we can detect what the mineral levels are like. And we know sometimes magnesium, chromium will diminish greatly in people that suffer from chronic fatigue and lack of energy.
How does this differ? Okay, I'm a patient now, Doc, and I come into your office and I have chronic fatigue syndrome, or I've just gone to my medical doctor and he did blood testing and urine testing. Just for my own information, how does that differ, from that testing, so the audience will understand?
So let's say you go to Quest Diagnostics,
yes,
and you get blood done.
Right.
They're looking at usually the medical profession or the medical world is looking for a pathology, a real abnormal blood value.
Right.
When the Phoenix Physical, if you will, or the fluid analysis, gives us predictability values of your blood. So when we look at a Quest Diagnostic blood report, they look at blood chemistries, CBCs. If you really wanted to look at specific mineral levels, that's a totally different testing procedure.
Which is not normally done.
No, not in a regular Quest Diagnostic or blood testing.
Okay.
With this type of testing, we understand what the concentration of minerals are in those fluids, as opposed to a specific mineral dysfunction or lack of.
See.
So this is a global testing for overall physiology.
Right.
Blood is fantastic if you're looking for a specific marker of something.
Yes. Okay, great. And how about hormone levels? A woman may let's take a patient who comes into a woman who's having hormonal problems, or maybe can get pregnant or so. Talk to me about hormones and this testing.
Usually when we see, whether it's infertility or PMS or the menopausal realm, menopause is a natural process that women go through.
Yes.
And men, So andropause is a reality in men as well.
Okay.
But when we look at menopause per
A lot of
se,
people don't know that, so that's a great point.
yes, so it does happen in all of us.
Sure.
So there's more of a hype in the menopausal realm, and there's a lot of drugs to promote and improve menopause, synthetic hormones and so forth. This testing actually tells us about 2 or 3 major things involved in hormone production. One is pH. So pH, all hormones are pH dependent. Hormone receptor sites, or the way that hormones utilize enzymes and minerals to make themselves work, are pH dependent.
Right.
So we understand if somebody's having a hormonal issue, if you will, which is normal, but they shouldn't. Women and men really shouldn't be symptomatic as we age during these natural processes. We'll say of menopause, where they stop being able to reproduce. That's normal.
Right.
But why should you be symptomatic? Is it normal to be symptomatic? No. It's a natural process. So pH is something that we look at in the digestive system, because let's say somebody has poor digestion,
right,
and we see it in their saliva pH.
Right.
If they don't break down fats or lipids, then lipids and fats are what create hormones.
Right.
And that's through the adrenal gland system with cortisol and DHEA.
Right.
That's with just cholesterol, which produces testosterone, estradiol, estrogen, all the estrogens and progesterone. So again, it doesn't give us a specific hormone that's imbalanced. It just says that there may be an imbalance based on these abnormal readings.
Right.
And so as a practitioner, I would do more specific testing to understand the hormone-related deficits, whether it's DHEA, whether it's estradiol, whether it's testosterone.
On that note, DHEA, common buzzword these days. Talk to me about DHEA. What is that?
DHEA is an androgen, or a hormone,
right,
that's produced by the adrenal glands.
Okay.
We all produce it, men and women, young and old.
Right.
As we age and we go through stress, and I know you haven't had any of that based on what you've just told me.
You're right.
But with the adrenal system, the adrenals actually get weak with age, and with neurological problems, that manipulation would help.
Sure.
But with time, we see that the adrenals start to decrease their ability to secrete something called cortisol and DHEA. Right. And again, when we look at the athlete, cortisol and DHEA, along with women and men, regardless, is very, very important, because DHEA is converted into estrogen, progesterone, and testosterone after and during menopause. So why do women demineralize their bone during menopause and after menopause? Right. They lack DHEA. They're supposed to lack estrogen from the ovaries and progesterone.
Right.
So we see that DHEA is important for muscle development as we age. Should we exercise more as we age? Yes, we should, because exercising causes more of a release of DHEA. Yep. So DHEA is that hormone released that's converted into these other hormones that are very imperative for males, females, and the athlete.
And DHEA can be taken as a supplement?
Yes.
And how do you determine how much that someone can take? I'm going to go into GNC, Doc, and how do I know what to buy?
Well, I certainly wouldn't do that.
Okay.
And that's no hit to a vitamin company, but we only because we want to give them the professional recommendation. Right. We don't want somebody who's non-qualified utilizing this, giving somebody DHA when you don't know what the levels are like, you don't know if there's an abundance of it, you don't know if there's a deficiency of it. Because to understand and to tweak those hormonal systems, you have to know exactly what to look at. Right. We also do saliva testing on DHA and cortisol through a lab in California, which is phenomenal. And so we can understand what someone's DHEA level looks like based on saliva again.
Okay. Always the key is always to
test,
get the results, know what you need. Don't just be going out buying something.
And to make a point about the DHEA, the DHA that we recommend is a natural wild yam-based DHA. They derive the DHA from wild yams. So it's not a synthetic hormone. It's not bio-identical. It's not like that.
Okay.
It's all natural.
Okay, great. Talk to me about body fat. So many people want to lose weight. I mean, population, while we're hearing so much about nutrition, I mean, so many people overweight.
Absolutely.
Talk to me how this plays into that role.
Well, when we look at anything from the extremes of obesity to just having a little tire around your gut to just kind of toning up your arms, if you will, fat development is really based on 3 hormones. One real hormone called insulin. Insulin is released from the pancreas when we eat food. Insulin will take that blood sugar and store it into the cell as energy. Once the insulin does that, and the cell is quote-unquote filled with glucose, it'll take it and store it as fat into fatty tissue. With this type of testing, we can't tell you if your insulin deficient or there's an abundance of insulin, like a diabetic condition.
Correct.
We can tell if there may be a disease process happening based on these values. The nice thing about this type of testing with weight loss is if you have poor digestion,
Right.
or pH that's inappropriate, people that try to lose weight, the athlete, the young adult, the adult, whoever it may be, if there's a buildup of fatty acids or too much like fat or lipids in the system, or the breakdown of fats are called fatty acids, the body at abnormal pHs will store that fatty acid as fat.
Right.
So let's take an athlete. An athlete exercises, builds up a lot of lactic acid, assumes that they have to take unbelievable amounts of protein into their system, which actually becomes acidic.
Right.
If
It changes that whole pH that we talked about before.
Absolutely, absolutely. So now if the pH is altered and they're not utilizing the fats for energy, then they store it as fat.
Right.
So pH is very important. Oxidative stress and resistivity levels are very important for looking at the person who wants to get cut up and defined, if you will, or lose that body fat. They've been trying with fad diets and, all the diets that are out there.
Sure, that's great. And how about exercise, aerobic exercise? How does that play into this whole recommendation that you would recommend after being tested properly?
Again, when we aerobic exercising, by definition, is aerobic and oxygen.
Right.
When an athlete, most people that do aerobic exercising, whether it's running or a training, swimming, biking, cycling.
Tell the audience, I'm sorry, I have to interrupt you, the difference between aerobic and anaerobic exercise.
Excellent.
Good.
Anaerobic is where we utilize more of an oxygen-based exercising program like running or swimming.
Right.
Anaerobic is less oxygen needed for performance, like weightlifting, strength training.
Right.
Those are more of the anaerobic type of activities.
Okay.
So soccer would be associated with aerobic.
Aerobic, sure.
Weightlifting and deadlifting would be associated with anaerobic.
Okay.
In both of those processes, obviously we need oxygen.
Correct.
In the aerobic realm, with yoga, Pilates, non-resistance type of activity, we utilize oxygen. The oxygen produces free radicals.
Right.
So with free radical production, just from normal aerobic exercising, we either use those electrons from the oxygen utilization as energy, or they become free radicals.
Right.
So you may look at your weekend warrior or look at someone who says, man, you're aging pretty quick. What's going on? I don't know. I exercise every day. You never looked at oxidation. And so when we look at athletes, sometimes we see, here's an example. I had a 34-year-old athlete come in whose biological age is 96. His oxidation levels were unbelievable. We see most athletes having high oxidation.
Sure.
So when we do aerobic exercising, it's very important not only to get measured for oxidative stress, but we also want to look at making sure the diet is normal for normal nutrient acquisition with good saliva pH and antioxidant therapy. So vitamin C, OPCs, these type of grape seed extracts are super important for athletes, for us in general, to improve the antioxidation during aerobic exercising.
Gotcha.
Anaerobic exercising utilizes oxygen, but it's more of lactic acid that's used for energy. So when we produce lactic acid, when the muscles fire and we get that burn as we're doing something, that burn is because of lactic acid and carbon dioxide. That system also produces free radicals, something else to look at.
Right.
But the anaerobic exercising, again, is less oxygen dependent and more lactic acid dependent. So we can also tell if you're utilizing the lactic acids appropriately for your energy and performance. If you're a weightlifter, football player, baseball player, any of these things.
That's great. How about an injured athlete? So is it going to help to prevent injuries once we know? Talk to the audience about that one.
Yes.
Hamstring pulls,
things
like that. It's a big one.
I'm sure you see it quite a bit, just like I do.
Yep.
We see when we get into the musculoskeletal realm of injuries, we see it as one whole one multifaceted issue with two different kind of problems associated with it. In other words, somebody may have a hamstring issue, they may have fatigue or pain. Now we need to look at their chemistry. We look at their chemistry through mineral levels. We look at their chemistry through oxidative stress or free radicals, because we know those can damage the athlete and slow down their recovery, as well as decrease pain and inflammation. But we also need to know, as a chiropractic physician like yourself, we know that the musculoskeletal system and the nervous system are imperative for any athlete. Let's say somebody pulls a hamstring. There's certain aspects of the brainstem and brain that control a link of nerve cells on one side of the body that controls muscles in the arm, the front of the arm and the back of the arm, the front of the leg and the back of the leg. Let's say somebody has a chronic ankle sprain, a heel spur, and a tight hamstring or glute or rear end on one side.
Yep.
We know that if those posterior muscles are tight, that's because something is weak. So if the back of the leg gets tight, the front is usually weak for neurological reasons.
Correct.
And so by stretching a hamstring that's tight, it's inappropriate. Because when you slow stretch something, what are we really doing to it? We're turning it back on, which makes it tighter.
Sure.
So now you see some of the Yankees, some of these professional athletes blowing their hamstrings out and saying, why can't these guys recover? We got to look at chemistry with them, and we have to look at the musculoskeletal system with individuals, weekend warriors and professionals as well, to understand muscle imbalances.
Right.
And we understand that if the hip flexor or the thigh gets weak, the hamstring's going to be tight.
Sure.
Don't touch the hamstring. You better exercise the quad and the hip flexor to shut that off.
Always a balance.
Always a balance.
You know?
Always.
Right. Antagonistic.
Exactly. If one
together.
contracts, the other has to shut off.
There you
So we just need to work with that system to improve them on the field, their performance, and post or recovery if that happens.
Okay.
We reset the muscle tone, get a neurological balance, and restore the chemistry.
Makes so much sense.
It makes
it's
just
so much
what it
sense. And, you know, we were going to talk a little bit about ADD and ADHD, and that's such a huge topic, and I don't think we could even get it in tonight.
That'll be a whole
but
other...
you know what? I think we'll have you back. Maybe we'll talk about that and just
Perfect.
off anatomy. So many kids are getting treated for ADHD and problems with focus, and even professional athletes could use some really good nutritional support in that department.
Yep.
So I wish we did have time to continue on that subject, but we'll have you back.
Absolutely.
I would like to thank Dr. Zembroski for being with me tonight.
Thank you very much.
It's been a great pleasure and very informative.
Thank you for having me.
And thank you for being so attentive to the show. Look forward to seeing you on the next show. I'm Dr. Bizzoni. If you have any email questions or any questions, you can email either Dr. Zembroski or myself on our websites, and we'll be happy to answer those questions as soon as possible.
Absolutely.
So thanks a lot, and see you on the next show.